All right, so in addition to blood pressure, the other two vitals that you're going to take on every patient are going to be pulse and respiratory rate. So I just wanted to explain how to check a pulse and a respiratory rate. So it's pretty simple. Um, for a conscious adult, you always want to check a pulse on the radial pulse. So your radius is the bone along the thumb side of your arm. Remember, radius is rad, thumbs up. It's on the thumb side. That's your radial pulse. You can get an ulnar pulse over here on the other side, but it's way more difficult to feel. So to find the pulse, just check it on yourself first, see if you can find it. So you have your radius, and then there's another structure here that I think it's actually cartilage, but it feels like a bone. And so along your wrist here, if you kind of push in, you should feel like basically like a hot dog bun, and you're feeling in the middle of the hot dog bun between those two bony type structures. And so you should be able to feel your own pulse. Some people, it's easier to feel up here more distally, closer to the wrist. And some people, it's a little bit further, more proximal, a little bit up. But usually somewhere within like 2 inches of the wrist, you can find the pulse pretty easily. The trick to finding it is how much pressure you want to push down with. So if you push down with too much pressure, you'll basically pinch off the blood flow and feel no pulse. And if you're barely touching them, you won't be able to feel it. So you want to kind of get the feel for how deep do I need to push down, and how to be able to feel the pulse. So feel around until you can find a pulse on yourself. Once you've found it, keep your hand on the pulse, and then you'll need a watch or a clock with a second hand. Or at least that shows the seconds. And a lot of people, they like to try to pull out their phone and use their phone timer. If that's all you have right now, use that. But you really should get a watch. When you come in for your final exam and stuff like that, you should wear a watch, or if you're working as an EMT. I don't wear watches. I hate watches. I'm not a jewelry person. But for me, like when I ski patrol, I keep a watch just attached to the strap of my backpack with all my medical equipment in it. So I always have a watch there. So that's another thing you can do if you don't want to wear a watch. You can just attach one to your medical equipment. But anyways, so you have a second hand. The textbook answer, if it ever comes up on a quiz or anything like that, is you count the pulse for 30 seconds. So you're just going to feel that radial pulse, count every single time that you feel a pulse for 30 seconds. So you're watching the second hand, but you're counting the pulse. And then you double whatever number you get, because we want to know how many times the heart beats in a minute. So you count it and you double it. That's the textbook answer. That's what you do. If anybody ever asks, that's what you do. In real life, nobody has time for counting a pulse for 30 seconds. So we usually actually in real life count for 15 seconds. Now, if your patient, if you feel that it's a little bit out of rhythm or something like that, you want to go ahead and feel for the whole minute. So, if the pulse is really fast and you're having trouble counting it, you may need to go for a whole minute. But most of the time we go 15 seconds. So when you count for 15 seconds, now you need to take that number you got and multiply it by 4. That's not always easy for people, but you can double it and then double it again. So if you just multiply by 2 twice, that's the same as multiplying by 4. So if you count the pulse and you get 18, okay, double it once, that's 36. Double it again, that's 72. Okay, that patient has a pulse of 72. Don't forget to multiply by 4, because the entire ski patrol freaks out when you say over the radio that your patient has a pulse of 17. That did happen one time. It wasn't me, thankfully. But the whole ski patrol is like, and then there was a real quick correction of, 68. So anyways, make sure you don't forget to multiply it out. I think that's really it for pulse. There's really no other tricks or anything. If the patient's unresponsive, we always check the carotid pulse because it's easier to feel. If they're a pediatric, you may find it easier to get the femoral pulse, which is basically in the crease of the leg, almost like where the diaper is, where the band of the diaper meets the leg. Or you can get a brachial pulse, which is up along the humerus in a pediatric. But anyways, yeah, that's it for a pulse. Respiratory rate, very similar. Real simple. You just count how many times a person breathes. Again, the textbook answer is for 30 seconds, and whatever you get, you double it. In real life, we count for 15 seconds and then double it twice. The tricky one about getting respiratory rate is if they cough, talk, sneeze, anything like that, you have to start over. It has to be 15 seconds or 30 seconds of uninterrupted breathing for you to count the respiratory rate. And if you tell somebody, hey, I'm going to count your respiratory rate, they immediately start breathing faster, or they just stop breathing altogether because they know you're watching them. So it's this weird thing. So the best trick is when you're taking somebody's vitals, you say, hey, can I check your pulse? Sure. They outstretch their arm. You start to count their radial pulse. When that 15 seconds passes or whatever, just, take a mental note. Okay, I got 17. Just remember 17. And then just take their hand and just place it on their chest like this. Keep your hand there as though you're counting the pulse, but now you're actually counting their respiratory rate. Or if you want to keep their hand down on the chair or whatever, that's okay too. But keep your hand like you're counting the pulse. They'll think you're counting the pulse, so they'll shut up so you can actually count their breathing. And yeah, so that's the best trick I have for that. You're watching for chest rise. You can watch their shoulders rise and fall as they breathe. Some people will put a hand on their shoulder so they can count their breaths that way. That's it. Count the breathing and do that. The other vitals that we check are oxygen saturation. For that, we just put the little pulse ox on their finger, and then blood glucose. And I'll have the blood glucometer out when you all come in for skills the first time, so you can practice it there if you want. But it's real simple. You basically, wipe their finger clean with an alcohol prep pad, wait for it to dry, poke their finger with a lancet. You have a little strip that you put into a little machine, and they're all a little bit different, but once you do it once, it's real easy. And then you touch it down to the blood to get the blood on the strip, and then the machine will turn on and tell you what their blood glucose level is. So that's pretty straightforward, but you can practice it when you come in if you want.